Hello guys, hi. Hi, this is Keshav from Dr. Behind the Scenes. So this time Kushbu is not joining. She's busy with something, some personal work. So if you're new here, so Dr. Behind the Scene is basically where we showcase our life, our journey, our experience, and our struggle. So you will find from live session with great teachers to study memes that we create. So this time our guest is Dr. Praveen sir. So let's call him on live. He's a great doctor, he's a great teacher, he's a faculty member of psychiatry, and a great motivator also. Hi, how are you?
Hi. Hi. I'm good. What about you?
I'm
All
good, I'm
good?
fine, sir. Yes, all good. So
I'm
thank you so
sorry, the
much.
lighting is not that
No,
good,
sir.
but I think it's doable. Yeah.
Yeah, it's totally fine, sir.
Hmm.
So thank you so much, sir, for joining. It's
Thank you for
like
having
a
me.
great pleasure for us. So Khushbu is not here, she's busy with some personal work. So yeah. So, sir, let's start.
Yeah, sure.
Okay, so sir, basically the agenda of this live is so basically we talked about how an foreign medical student prepare for FMG, but
Mm-hmm.
FMG is not just a stop, right? There's a long way to go after that also.
Mm-hmm.
So
Mm-hmm.
there's a long way, like we have to prepare for post graduation, and for that we have to give NEET PG. So the agenda
Mm-hmm.
of the live is basically how an FMG can prepare or a foreign medical student can prepare in a way
Mm-hmm.
that it helps to clear NEET PG also. या
Mm-hmm.
सो ज्यादा इस पे बात नहीं होती है, मोस्टली एफएमजी पे होती है. सो इट्स अ
Mm-hmm.
काइंड ऑफ थोड़ा सा खाली एरिया.
Which is kind of unfortunate because preparation for FMG exam and preparation for NEET PG exam and whenever it becomes next जब भी होगा वो it's not that different है ना.
ओके.
I mean I've been teaching for many years now and I have been teaching FMG students and Indian graduates both
यस.
and I don't see much of a difference in the preparation. And not only me, if you talk to any faculty member, most of them would tell you that almost it's the same thing. It's
यस.
just that uh, as far as FMG is concerned, you have to get a particular percentage, which is 50% right now.
यस.
NEET PG में who comes first, who comes in those 500
रैंक इज
in
देयर.
the top 500 rank or 1000 rank. उसके अलावा I don't see कोई बहुत ज़्यादा difference होता है. So
बट स्टिल.
I mean, whenever the exam becomes same, so many FMG students are worried that in future probably the exams will become same, and many are thinking that it's a bad thing. Personally, I believe it's a great thing to happen.
या.
Whenever it happens, it would be very good for FMG students. They would have to prepare for one examination, and the best thing is they would be able to shed this mindset. जहाँ पे ना they think that कि चलो FMG निकाल लेते हैं फिर NEET PG देखेंगे.
हाँ हाँ
So we have to
एग्जैक्टली.
come out of that mindset. And I mean, if the exam pattern gets changed, I think it would be really nice.
यस सर. सर बेसिकली जो एफएमजी का पैटर्न होता है वो लिटिल बिट लाइक नीट पीजी का जो पैटर्न होता है लिटिल बिट क्लिनिकल टाइप होता है, एंड नॉट एफएमजी का क्लिनिकल टाइप नहीं होता. सो इन अ
ऐसा
वे
नहीं है
जैसे वो
दोस्त, ऐसा नहीं है क्योंकि इफ यू
हाँ.
लुक एट psychiatric questions and many even medicine surgery of late they have been asking clinical questions,
हाँ अभी काइंड ऑफ धीरे धीरे चेंज हो रहा है वो भी. एफएमजी भी
right?
मोस्ट काइंड ऑफ जा
You
रहे
want me to speak in Hindi or English?
हैं. बोथ इज फाइन सर.
दोनों चलेगा. हाँ
इंग्लिश वन यस.
जी देखो, अब आप लोग जैसे आप लोग स्टूडेंट्स हैं, you tend to see the paper which happened last year, right? For us faculties who have been seeing these papers 10 years, even for the PG entrance the pattern keep on changing. At times they would ask
ओके.
very factual question, the
ओके.
exact question that comes in FMG. On other occasions they would ask clinical questions. तो
यस
ऐसा
सर.
नहीं है कि FMG में clinical questions नहीं आते हैं. Even this is not true कि PG में clinical question ही आते हैं. These
ओके.
things change.
ओके.
and
ओके.
and see, even if the question is clinical or even if the question is factual, that hardly makes a difference of say 5-10% in the preparation.
ओके.
Preparation remains the same. So
ओके
so
सर.
in the minds of students, these distinctions are very clear cut,
या.
that this is how we should prepare for FMG, this is how we should prepare for NEET. But if you ask me, I don't see a lot of difference. चीजें वही रहती हैं.
But students think like they have prepare something for FMG and we have prepared different
हाँ.
for NEET PG.
हम्म,
So that's why
हम्म,
ये basically इसके लिए था. So if we divide
हम्म,
this into two parts, like for the FMG students when they're in college years,
हम्म,
what should be their approach or strategy to prepare? And once they clear FMG exam, what should be the
हम्म,
approach then? So let's start with
हम्म,
the first one when they are in college years, in the 6 years, since we have a
हम्म,
long time than Indian students, 6 years. So
हम्म.
how they can approach or what should be the strategy for that?
Correct. So I think yes, you guys have 6 years. That is an
Yes.
advantage and a disadvantage, right?
Yeah.
Anyways, MBBS is a long course. Even in India, 4.5 years is a long time, and then additional 1.5 years. What I feel is that students in the beginning, at least, they should focus on the standard books. Now
Okay.
nowadays, that thing is becoming less common even in Indian graduates. When we used to be the students, almost everybody would read standard books. uh, Now when I talk to students, a large number of them are not reading them, and some are reading, the smaller versions of the books,
Yes. Yes.
and some others are going directly for the coaching institute material.
Yeah.
So
Exactly.
see, I'm a part of many coaching institutes, but I'll be very frank. I think that in the beginning, uh, standard textbooks are the ones to go for, and no coaching institute material, no notes can replace those.
Okay.
Of course, the notes and videos and everything is good, but they can be a supplement to your standard preparation.
Exactly.
It cannot be a replacement to your preparation. So
Yes.
this is something to be remembered. And secondly, my interaction with a lot of foreign medical graduates tell me that the culture of the colleges that you guys study in, I mean, whether you are in Ukraine, whether you're in China or Philippines, Nepal, the culture varies. There are certain colleges where people are studying pretty hard, and they
Yes.
are the ones who are able to, get selected in the first attempt itself, or they are able to pass the FMG exam in the first attempt itself. Then there are colleges where the culture is not that good and the students struggle. So what I would want to suggest is that irrespective of the culture in your college, if you continue studying and if you continue to hang out with people, or communicate with those students who are studying, it would become much easier. It's all about a company, है ना?
Yeah. Yeah.
आप
Yeah.
इंडिया से दूर हैं,
Exactly.
आप घर वालों से दूर हैं, फ्रीडम है, पहली बार जिंदगी में फ्रीडम मिलती है, राइट? So it is easy to forget why you are there. And that is not true only for you guys, even for people like us. Uh, when we went to hostel for the first time, we also got out of the homes, and there was no mother, no father to
No
keep a tab on
restrictions.
what we were doing, and there was freedom. But हम लोग अपने आप को याद दिलाते रहते थे कि भाई ज्यादा आवारागर्दी नहीं करनी है, थोड़ी बहुत कर लो, ज्यादा नहीं करनी है. एंड
या उसका
एंड
ऑपोजिट हो जाता है.
हाँ. सो देखो, वही है कि एफएमजीज में और इंडियन मेडिकल ग्रेजुएट्स में कोई ज्यादा फर्क नहीं होता. इनफैक्ट मैं तो कहूँगा कोई फर्क नहीं होता है, राइट? इट इज जस्ट दैट व्हाट यू गाइस डू इन दोस 3.5 4 years, दैट मेक्स ऑल द डिफरेंस. इफ यू
Yes.
कैन रिमेन फोकस्ड, इफ यू कैन कंटिन्यू स्टडिंग थोड़ा बहुत भी सही, there is no reason why you cannot get a good rank in NEET PG, or forget NEET PG, even in the bigger institutes like AIMS and PGI, there is no reason why you can't go into those institutes. बट
Okay.
पढ़ाई नहीं करोगे 3 4 साल तक, और ये मन में रख लोगे कि लास्ट में जाके इंडिया में 6 महीने
Yeah.
कोचिंग करके करेंगे, तो सेलेक्ट तो हो जाओगे उससे पहली बार में, नहीं तो
But
दूसरी बार, बट देन यू विल स्ट्रगल लेटर ऑन, है ना?
a lot.
तो जो जो फॉर्मेटिव ईयर्स होते हैं, दे आर वेरी इंपॉर्टेंट, एंड वी शुड नेवर फॉरगेट दैट.
Yes, sir. So basically, enjoy bhi karo, and along with it, study properly.
स्टडी करो,
Study.
हाँ. आई मीन
Yeah.
स्टडी शुड बी अ पार्ट ऑफ योर लाइफ, एंड इफ यू आर बिकमिंग अ डॉक्टर, स्टडी से भाग नहीं सकते आप,
Exactly.
right? So be consistent. And see, again, I would repeat myself, be in touch with those students who are studying. If there's a group who refuses to study at all, बस घूम फिर रहे हैं, तो stay away from them, because
So
company is everything. है ना?
company matters a lot.
एक थ्योरी है कि any individual is kind of the average of 5 people around him. आपके
Yes.
आसपास जो 5 लोग कर रहे हैं, उसके एवरेज कर दीजिए, आप भी वही करेंगे,
Hmm.
right? So
Exactly.
be very careful about the people you are hanging out with. I'm not saying कि जो लोग घूमते फिरते हैं, they are bad people. I mean, but अगर आपका एम पढ़ाई है, आपका एम एक सिलेक्शन है, then you have
Mhm.
to be with people जो थोड़ा पढ़ाई कर रहे हैं, थोड़ा बहुत भी कर रहे हैं तो भी चलेगा.
Yes, sir. And sir, the thing is, FMG mostly lacks in clinical part.
Hmm.
Like me, I also lack in clinical part because यहाँ पे clinical exposure उतना नहीं है. So how
Hmm.
to overcome that? Because since जो exam pattern is changing, and exam pattern is going more towards clinical questions or clinical things. So how to overcome that? How to, like, what to do for that?
Yeah, देखो, honestly speaking, see, आप लोगों का क्लिनिकल एक्सपोजर कम है, that is true.
Yes.
बट इवन इन इंडियन कॉलेजेस ऐसा नहीं है कि सबका क्लिनिकल एक्सपोजर बहुत अच्छा है.
Okay.
I don't think a large number of students even go to clinical postings, right? And more importantly, even if you go to the clinical posting, होता क्या है? अब आपको एक कमरे में बिठा दिया जाएगा, लास्ट में कोई सीनियर रेसिडेंट आएगा एंड ही विल आस्क यू क्वेश्चंस. इफ यू आर इन फाइनल ईयर, ऑफ कोर्स यू हैव टू सी केसेस, but otherwise clinical exposure is not that much even in India, right?
Okay.
In comparison, I mean, when I was in US, when I was working in those hospitals, I saw that medical students were a part of treating team. Everybody was assigned a patient, and they would know, they would even put notes. In India, what happens? We have like 20 students in a group, and the teacher will come, the SR will come, he will assign one case. Out of 20, 18 would be talking amongst themselves, one would be taking history, last one would be presenting. So it's not
Yes.
that there is a huge amount of difference.
Okay.
This is first thing. Secondly, having clinical exposure and solving clinical questions are two different things, right?
Okay.
For example, I had taken USMLE examination. I had taken step one. I had also cleared CS examination in US. Now, when I was preparing for step one, it's completely clinical, as you must be aware, right?
Yes, sir.
And the things would be, a patient comes, and these are the parameters. This is what you find on the examination. What you do next,
Yes,
right?
sir.
Now I am a graduate from one of the, from UCMS, University College of Medical Sciences, one of the good colleges, which always comes in top 10, 20, in the list. But even I had not seen any of those scenarios in my MBBS, during my MBBS days.
Okay. Okay.
But when I started reading about those cases, when I started reading about the text material, then I understood कि, okay, this question को ऐसे करना होता है, right? So don't make this
Okay.
mistake that you need to have real clinical experiences to solve clinical question. That is not true at all.
Then it's
More
like
importantly,
थोड़ा
what you see in clinics is not what happens in the MCQ word, right?
Yes.
MCQ में तो साफ साफ बोलते हैं ना कि what next. रियल
What
वर्ल्ड में
next?
थोड़ा ना होता है. रियल वर्ल्ड में तो होता है कि उस वार्ड में चले जाओ, उस वार्ड में चले जाओ, अटेंडेंट को बुलाओ, साइन करवाओ, right? So clinical exposure and solving clinical questions are two different things.
Okay.
Why am I saying this is because you should not have this notion in your mind that you have a handicap. कई बार बच्चे कई बार बहुत डिसअपॉइंटेड हो जाते हैं कि सर हम क्या करें, हमारे तो पढ़ाते ही नहीं है. उससे फर्क नहीं पड़ता है. तुम्हारे यहाँ क्या होता है इससे कोई फर्क नहीं पड़ता. तुम क्या करते हो इससे पूरा फर्क पड़ता है, राइट? तो कम से कम अपने दिमाग में ये सारी बातें निकाल दो कि इन माय कॉलेज देयर इज नॉट इनफ क्लिनिकल एक्सपोजर, इन माय कॉलेज दे स्पीक इन रशियन, इन माय कॉलेज दे स्पीक इन चाइनीज. सी यू कैन नॉट चेंज दोस थिंग्स, एंड देयर इज नो पॉइंट थिंकिंग अबाउट स्टफ दैट इज बियॉन्ड योर कंट्रोल. क्या उन सब चीजों को हटाने के बाद द टाइम दैट यू हैव, आर यू यूजिंग इट प्रॉपर्ली? एंड इफ द आंसर इज नो, देन फर्स्ट लुक इनटू योरसेल्फ कि मैं क्या कर सकता हूँ, रादर देन कि कॉलेज में क्या हो सकता है.
Yes.
एंड बिलीव यू मी, इंडिया के कॉलेज में भी कोई ऐसे बहुत जमीन आसमान का फर्क नहीं हो रहा है. Probably maybe an AIMS or a couple of colleges, but the vast majority of colleges are lacking in clinical thinking. Right?
Okay. And sir, so basically here is 6 year of colleges, 6 year of college life. So if we divide, so first 3 years is of pre-clinical years, and next 3 is clinical part. So what should be what should be the approach for first 3 year students to study for that, for like they should prepare for exam? Should this initially start focusing on exam pattern, or they should study the standard books and go with general things, or go with the college?
So see, the thing is preparing for entrance examination is anyways tough, right?
Yes.
So you cannot stay in that mode for 4-5 years. It is impossible.
Exactly.
तो वैसे करने का कोई फायदा भी नहीं है, right? देखो, if you have good knowledge, doing MCQs is quite easy. But even if you do a lot of MCQs, that would not automatically mean that you have good knowledge. Are you getting me? Knowledge
Yes,
is
sir.
what is important, और उसको यूज करके आप MCQ कर लोगे. लेकिन अगर आप सिर्फ MCQ फर्स्ट ईयर से शुरू कर दो प्रैक्टिस करना, आई मीन कर सकते हो, बट आई डोंट सी एनी एडेड एडवांटेज. आपने फर्स्ट ईयर में जो किया वो फिफ्थ ईयर तक आते थे, वैसे भी भूल जाओगे आप. तो see, as you continue studying and as you continue becoming more and more senior, थोड़ा सा टाइम भी कम होता जाता है. एटलीस्ट इंडिया में तो होता है, आई एम श्योर बाहर भी होता होगा. तो है ना, तो थोड़ा सा पैथोलॉजी, फार्माकोलॉजी, फिजियोलॉजी, आई मीन यू शुड बी गुड एट दीज थिंग्स, एंड यू हैव टू स्टडी इन द initial years only to become better at these, because once you come in your final year or pre-final year, anyways you have to study medicine, surgery, pediatrics and everything. Time भी कमी होती है. तो पहले 3 साल थोड़ा सा focus on getting your basics strong.
Okay.
And in the later part of the preparation, later part of your graduation, you can become more MCQ oriented.
Okay.
But last line जो मैं बोलूंगा इस क्वेश्चन पे वो यही है कि नॉलेज अच्छी है तो MCQ करना बहुत आसान है. और नॉलेज अच्छी नहीं है तो चाहे आप MCQ फर्स्ट ईयर से करते हो चाहे फाइनल ईयर से करते हो, इससे कोई फर्क नहीं पड़ता.
बात सेम है.
राइट?
Exactly. And for those who already like cross the third year and they're in fourth, fifth, and sixth year, now they should focus on exam, right? They should, or they should
यू आर
just
टॉकिंग
fill the
अबाउट द
same.
यूनिवर्सिटी एग्जाम?
No, I'm talking about the entrance exam, about this FMG and next. They should prepare in a mindset like they have to give the exam, how they should
सो
prepare. Or
हाँ, सो माइंडसेट का मतलब ये है कि एमसीक्यू बुक्स देखना शुरू कर दो साथ में, या
okay.
फिर जो लास्ट ईयर क्वेश्चंस क्या हैं वो देखना शुरू कर दो। देखो होता क्या है ना, जैसे हम लोग जब पढ़ते थे, जब मैं सेकंड ईयर में था, थर्ड ईयर में था, तो व्हाट वी वुड डू इज वी वुड हैव अ फेयर नॉलेज कि किस टाइप के एमसीक्यू आते हैं,
Okay.
so that while reading we would have some understanding कि okay this is something that can be asked as a MCQ.
Okay. Okay.
That does not mean कि हम लोग MCQ सारे सॉल्व करते थे साथ में, है ना। Having
Okay,
a
sir.
basic idea is I think sufficient. So when you are studying you know कि okay this is something that can be asked. But
Okay.
the worst part जो कई सारे बच्चे करते हैं वो ये है कि पूरे साल पढ़ाई नहीं की एंड लास्ट में जाके आपने जो भी कुंजी टाइप होती है ना, जो छोटी छोटी बुक्स होती हैं
Guides.
उसको पढ़ लिया आपने, उससे अगर आपके एग्जाम में नंबर अच्छे आ भी जाते हैं तो भी आप स्ट्रगल करोगे जब आपका एंट्रेंस एग्जामिनेशन आएगा,
Exactly.
क्योंकि एंट्रेंस एग्जामिनेशन की कोई भी कुंजी नहीं होती है। ये बात हमेशा जिंदगी में याद रखना कि कुंजी से आप या पिछले 5 साल के पेपर्स पढ़ के आप एग्जाम तो पास कर लोगे, लेकिन एंट्रेंस वाले 6 महीने या साल में फिर आप बैठ के दुखी हो गए कि यार पढ़ाई क्यों नहीं की उस टाइम पे, क्योंकि उस टाइम 19 सब्जेक्ट्स होंगे आपके पास।
Yes, sir.
तो प्लीज रिमेंबर कि प्रॉपरली पढ़ाई करनी है, टाइम पास नहीं करना है।
And sir, I think मतलब initially FMG से पहले ये clear हो गया. And for those student who cleared FMG exam, now उनका mindset क्या होना चाहिए? Like still they already studied for 6 or 7 years. Now they have to study again for 1 year. They have to do internship for 1 year. Then they have to give NEET PG. So like what should be the mindset and like how to stay motivated for those 1 or 2 years again to again prepare for another exam?
हाँ यार, सो द थिंग इज दैट हम मेडिसिन में आप आए हो तो एग्जाम से डरने का फायदा नहीं है ना, और डीमोटिवेटेड होने का फायदा नहीं है। देखो मैं एक बात बताता हूँ आपको, जब हम लोग ऐसा स्टूडेंट सोचते हैं, मेडिकल स्टूडेंट, तो वी टेंड टू कंपेयर आवरसेल्फ विद पीपल हु आर डूइंग इंजीनियरिंग और हु आर डूइंग एमबीए, एंड समटाइम्स वी फील कि यार हमारे साथ तो बहुत ही खराब हो रहा है ना, कि हमारी एज बढ़ती आ रही है, लोगों की शादी हो गई, बच्चे हो गए और अभी हमारी पढ़ाई खत्म नहीं हो रही है।
Yes.
राइट, तो दिस इज ट्रू, ये बात सबके मन में आती थी, हमारे मन में भी आती थी जब हम स्टूडेंट्स थे। लेकिन आपको जो मेहनत आपकी लगती है उसके एडवांटेजेस भी बहुत मिलते हैं आपको बाद में जाके, राइट। सो आई एम अ साइकियाट्रिस्ट, आई टेंड टू सी ऑल दीस पीपल हु वेंट टू आईआईटी और आईएम, और ना मतलब आई लिव इन दिल्ली एनसीआर, तो आई सी पीपल जो कि अच्छे अच्छे ऑफिस में जाते हैं, अच्छी अच्छी कंपनीज में हैं, and they struggle a lot in the latter half of their life, right? I've seen so many people who are in their 40s and now they are worried कि जॉब से निकाल देंगे तो क्या होगा, राइट, दूसरी जॉब कैसे मिलेगी, या फिर दे आर वरीड कि न्यू टेक्नोलॉजी आ गई है, हमें हटा के नए बच्चे आ रहे हैं, या फिर दे आर वरीड कि जिस पोजीशन पे मैं हूँ उस पर स्विच करने का ऑप्शन नहीं है। आई हैव नेवर सीन अ डॉक्टर कमिंग टू मी एंड सेइंग दीज थिंग्स। So I have had plenty of 40-year-old patients or engineers or MBAs who are, even businessmen who are struggling in life despite having a great degree, because, their opportunities do not keep on expanding as they grow old. But for doctors, it keeps on becoming better and better. As you grow old, as you become more experienced, right, आपकी opportunities बढ़ती आती हैं। मैंने आज तक किसी 40-year-old डॉक्टर को नहीं देखा जो स्ट्रगल कर रहा है और बोल रहा है कि खाने के पैसे नहीं है। बट मैंने ऐसे बहुत सारे इंजीनियर्स को देखा है जो कि ऐसी बातें करते हैं कि जॉब चलेगी अब क्या करेंगे। तो आप लोग जो अभी सेक्रीफाइस कर रहे हैं, आई अंडरस्टैंड से सेक्रीफाइस, आई नो खराब भी लगता है, आई नो ये भी लगता है कि यार हमारे यूथ के दिन जा रहे हैं, लेकिन वो 5-10 साल की जो आपकी सेक्रीफाइस है उसके बाद वो 50-60 साल आप उसको वो भी करने वाले हो, उसके फ्रूट्स को भी एंजॉय करने वाले हो,
बेनिफिट्स।
तो हाँ, तो प्लीज रिमेंबर दैट। और अनदर थिंग इज दैट I see a lot of people, senior doctors putting negative posts that I'm so frustrated with the system, I'm so frustrated, ये हो रहा है वो हो रहा है, and I rarely see people putting positive post। उसकी भी एक साइकोलॉजी है, नेगेटिव चीजों को हम ज्यादा परेशान हो जाते हैं, अच्छा जब हो रहा है तो आई मीन अच्छा हो रहा है तो ठीक है एंजॉय करो लाइफ को, कौन जाके फेसबुक पे लिखना आता है, खराब हो रहा है तो फ्रस्ट्रेशन है लिख दिया। लेकिन वो जो नेगेटिव पोस्ट है उसका नुकसान ये है कि जो बच्चे हैं जो एमबीबीएस कर रहे हैं, जो बाहर हैं या इंडिया में ही हैं, उनको लगता है कि दिस इज व्हाट लाइफ इज, दे फील कि यार अभी भी मेहनत करे, पढ़ाई कर रहे हैं, और ये देखो ये तो 20 साल बाद भी रो ही रहा है, तो फिर फायदा क्या है? But please remember, those posts do not reflect the reality. They are one extreme of the reality. There is another extreme which is very nice, which is very rosy. सब कुछ अच्छा चल रहा है. And then there is a middle ground where most of the things are good, some things are bad. So I have been practicing for so many years. Even if I forget my teaching part, I would still say that being a doctor is one of the best things that you can do in India, and probably anywhere in the world. Right? There are hardships, but the benefits outweigh the hardships by many, many times. So when you get frustrated and when you have these thoughts in the mind, ki, for how long would I continue this life? Just keep on telling yourself that this is the toughest part. And I know you will think that this has been told to us since class 12. I understand that. But those 10 years or 11 years are really tough. I understand that. But after that, आप याद करोगे तो आपको समझ आएगा कि जो आपने 10-11 साल लगाया उसका फायदा भी हुआ.
So it's
So
worth
that is how you
investing.
keep. हाँ, so that is how you keep yourself motivated. बाकी देखो, FMG स्टूडेंट्स जब नीट पीजी के लिए प्रिपेयर करते हैं ना, तो सबसे बड़ी प्रॉब्लम उनके मन में ये आती है कि उनको समहाउ लगता है कि वो उतने अच्छे हैं नहीं, है ना?
Exactly.
दिस इज, आई डोंट नो दिस डिफिटिस्ट एटीट्यूड कहाँ से मन में आता है, बट जिस भी वजह से आता है ना? मुझे when people send messages on Instagram or Facebook, when a FMG sends a message, he would always say, "Sir, I'm not that good. I see people from Indian colleges; they are so much more intelligent and they are so great and they had so much better exposure. I would never be able to compete with them." This is absolute nonsense. They are not better than you in any significant way. You guys are quite similar, but you start believing for some reason that you are not that good, right? More importantly, PG examination is primarily, see, your rank is primarily dependent upon the amount of hard work that you can do, how intelligent you are, how great the memory is, and all these things become less important. If you can work hard, if you can sit for 10 to 12 hours on that chair in that reading room for 9 months, you would get selected. This is a rule. हमने हमने रेयरली किसी को देखा है जिसने 1 साल पढ़ाई की है और उसका सिलेक्शन ना हुआ, फॉर द सिंपल रीजन कि यार कोर्स है, बहुत कोर्स है, बट एक तरीके से याद ही तो करना है, समझ समझ के करना है, बट फाइनली याद ही करना है. So the single most important factor is how many hours can you sit and study. There are very few people who are so exceptionally intelligent, who have such exceptional memory that they can do it in 4 or 5 hours. A vast majority of us, whether you are IMG or whether you are Indian student or whether you are FMG, you have to work hard, and work hard करिए, selection हो जाएगा. बट उस थॉट प्रोसेस से बाहर निकलना पड़ेगा कि हम उतने अच्छे नहीं हैं. तुम उतने अच्छे हो भाई, तुमको किसने बोला? तुम खुद ही बोलते जा रहे हो.
सेल्फी अपने आप को डिमोटिवेट कर.
हाँ.
So sir, if like already if a student is preparing for FMG, so उसने already notes बना लिए, already made all the notes, he watched all the videos or whatever the class he joined, and then he was preparing for NEET PG. So then again he have to make another set of notes, or he have to join other institute, or this FMG preparation will help in this NEET PG examination.
It will definitely help. It will definitely help. Whatever you have studied, please keep those notes handy. And when you start with the preparation of any subject, start with those notes, and then keep on adding whatever additional has been told in the video, in case you join some institute. So that preparation never goes waste. इनफैक्ट अगर आप सिर्फ अपने FMG नोट्स भी पढ़ के नीट पीजी देने चले जाओगे, अगर आपको पूरा प्रॉपरली याद कर रखा है आपने, देयर इज अ फेयर चांस ऑफ यू एटलीस्ट गेटिंग 50% मार्क्स और 55% मार्क्स, उतना तो आ जाएगा. मे बी यू वुड नॉट गेट सिलेक्टेड, क्योंकि थोड़ा सा कोर्स ज्यादा होता है नीट में, लेकिन that definitely covers the basic course material. So this thought ki we have to prepare differently for NEET PG and FMG, even that is not correct completely. We can say that preparation for FMG covers a subset of the preparation for NEET PG, but then it's a substantial part.
Exactly. And sir, there is one question. It's my personal question. Like, there are very few seats in NEET PG in post graduation actually. So, and there are a lot of students, even FMG or IMG. So, if someone is prepared for FMG, not FMG, someone is already prepared for NEET PG, then the knowledge that he gets, will it help in other exam? Like, if now he's planning to give another exam like USMLE or something, because he hasn't got any seat in India. So that knowledge will help in another exams, or do they have to prepare from start?
No, it will definitely help. It will definitely help. Even when you talk about USMLE, the course material remains almost the same. It's just the
Pattern changes.
approach that changes. Yeah, the pattern that changes. So
Yes, sir.
USMLE, you have to do a lot of practice of reading those clinical vignettes very quickly, because they would give you 10 lines clinical vignette, and then you have to make a diagnosis, and then they'll ask you a question on the treatment or investigation. So that is a skill that you develop when you start preparing for USMLE. Indian
Yes,
PG examination more straightforward. FMG slightly even better, even more straightforward. So the course material remains the same. Depending upon the
okay.
examination that you are appearing for, you change the pattern of the preparation. So say if you are reading about schizophrenia, और schizophrenia का treatment तो वही रहेगा. इंडिया में
Yeah.
पूछ लेगा drug of choice, वहां पे clinical history देके पूछ लेगा. पूछेगा तो
Next.
treatment ही ना, और क्या पूछ लेगा.
So base remains same, just approach changes, approach and pattern
Approaches
changes.
changes, yeah.
Yes. Okay. And sir, most of the like students in comment section are asking about next. How it's
यार
gonna
अब तो वही है
be?
ना कि हाँ,
Like
किसको पता है.
half से ज्यादा
कोई
comments in
जानता है
next से
मोदी जी
भर
खुद
रखे
कुछ तो उनका ही रहे थे. मैं तो बताया नहीं मोदी जी ने कुछ.
हैं.
यार ये तो है ही, ये फेवरेट काम है बच्चों का, स्टूडेंट्स का, कि जो चीज की इंफॉर्मेशन नहीं है उसके बारे में पूछते रहो, है ना. तो सी नोबडी नोज, वी डू नॉट नो, नोबडी नोज, राइट. एंड इवन इफ द नेक्स्ट एग्जाम कम्स, उससे क्या हो जाएगा, कुछ बहुत फर्क नहीं पड़ जाएगा. अगर उन्होंने ये बोल दिया कि सिर्फ क्लिनिकल सब्जेक्ट्स आने वाले हैं, फाइनली उन्होंने बोल दिया, देन इट स्टिल मैटर्स, बिकॉज देन यू विल हैव टू फोकस मोर ऑन दोज सब्जेक्ट्स. बट अगर सिर्फ पैटर्न चेंज हो रहा है, तो पैटर्न तो हर 3 साल में वैसे भी चेंज होता है ना.
Exactly.
आपको क्या लगता है नीट एग्जाम हमेशा था? नीट से पहले कुछ और था. उस टाइम पे एआई पीजी, ऑल इंडिया पीजी अलग होता था,
हाँ.
स्टेट पीजी अलग हुआ करते थे. हम लोग तभी भी पढ़ाते थे, सब्जेक्ट्स तो वही थे. अब उसके बाद नीट पीजी आया तो थोड़ा चेंजेस हुए. अब नेक्स्ट आ गया, जैसे क्लिनिकल क्वेश्चन ज्यादा आने लगे तो थोड़ा चेंज और हो गया. सी मटेरियल रिमेन्स द सेम, बट just the way you practice questions, and just the way we slight changes in the way of teaching. There are slight changes that are made, but finally course material तो वही रहने वाला है, चाहे कोई भी एग्जाम आ जाए.
Exactly, sir. There's a lot of question है जो बच्चों से दे. Next,
So
about
please
next.
don't waste your time thinking about next. Nobody knows when will it happen, and whenever it happens, it will happen for everybody. There's no reason to freak out, है ना.
Just make your base strong, study properly. All exams
Right,
will be clear, right?
right. वो see actually ना, everybody wants कि कुछ 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 sophisticated सी एडवाइस मिल जाए,
हाँ.
है ना, जो कि बहुत ही अच्छी साउंड करे. ये जो बोरिंग बात है ना कि यार वही पढ़ना है, ये सुन के मजा नहीं आता. लगता है यार ये तो सबको पता है, कुछ नया बताओ. बट कुछ नया जबरदस्ती क्यों बताएं? जो तुमने बेसिक काम कर लिया तो कुछ नया बताया जाए. तो
Exactly.
प्लीज रिमेंबर दैट कि दे विल कीप ऑन चेंजिंग द नेम्स ऑफ द एग्जाम, बट आपके बेसिक्स वही रहने वाले हैं चाहे कोई भी एग्जाम आ जाए. अगर इफ एफएमजी स्टूडेंट्स आर लिसनिंग टू मी, आई विल जस्ट सजेस्ट यू वन थिंग, दैट प्लीज डोंट वेस्ट दोस प्रीशियस इयर्स. Have fun, but continue studying. Otherwise, I have seen both types of FMG students. Some of them come to India and they clear the FMG examination in the first attempt, and then they clear the NEET examination in the first attempt also. So there are these students who are really good and they are able to cross these hurdles very quickly. And then there are students who keep on attempting FMG for 5 times, 6 times, 7 times, and they keep on struggling. The final difference is what they did during those 4-5 years. So please do not waste your time. Ensure that you are studying. Ensure that you are studying consistently, and rest of the things become a cakewalk if you have done your work during your graduation. And there's no point worrying about these things like next and all. They are beyond your control. They are beyond my control. They are beyond control of everybody. Only government knows what is it going to do next.
Exactly, sir.
Right?
Yeah, yes. So yes, sir, thank you so much for joining. I know it was a short session, but it was totally worth it. You are amazing, sir.
Thank you.
You're a great motivator.
Great.
Thank you
Great.
so much for
Thanks
joining.
for having me. Thanks for having me.
Thank you so much
All
for
right.
joining. Bye, sir.